See. Okay. Welcome, everyone. My name is Emily. I work with Minnesota Valley Action Council. I do the Adult and Dislocated Worker Training Program. So this is the quarterly networking meeting. It used to be Blue Earth, Nicollet County. It's kind of just become whoever is able to join and learn about resources that are kind of around the Mankato area and potentially surrounding areas. So today our guest speakers are from Minnesota Retain, and they will do a presentation, and then if you have questions, there'll be time for that, and we'll move into roundtable as usual. So I will pass it on.
Great, I'll go ahead and share my screen quick. So yes, we'll do some quick introductions before launching into this. My name is John Connell, and I work for the Minnesota Department of Employment and Economic Development. I'm actually part of the employment and training team, so we do WIOA related programs and state dislocated worker. So it's good to be checking in. I, however, am the program coordinator for Minnesota Retain, and we'll get a little bit more into what Retain is, our goals, and stuff like that. But I'll hand it over to Sam to introduce herself.
Hi, thank you for having us. My name is Samantha Westwell. I'm the lead return to work case manager supervisor. So I supervise our team of return to work case managers who are providing services on the healthcare side. And I'm actually located in the Mankato area. So was excited to see this come through because I would love to kind of get the resources out there more in our immediate area.
Excellent. Thank you. So let's get started here. Just a quick overview. We'll talk about Retain, about how injuries affect the workplace. We'll go into, what does eligibility look like for Retain, the process, and sort of walking through, what a participant can expect. And then talking a little bit more about sort of employer-specific information. So what is Retain? We are the Retaining Employment and Talent After Injury and Illness Network. We're actually one of 5 states that were granted an award from the Department of Labor to implement this clinical research study. We have since hit our enrollment goals on the study in mid-April. So we're working right now into pivoting into less of a clinical trial and more of just a program to help folks in Minnesota. But it is a no-cost federally funded grant program that's really focusing on strengthening and retaining your workforce. So we're trying to assist employees return to work or stay at work whenever they have an injury or illness that impacts their employment. This can really be any illness or injury. As long as there is that sort of anticipated, leave or anything like that, that will potentially impact their employment. So we partner with healthcare organizations to provide early intervention strategies, and that's where Sam and her team come in to be the return to work case managers to really work out a plan on how to reduce that job turnover and how to, identify that plan to either stay at work or return to work when it's safe to do so. So really focusing on, driving retention, minimizing those costs of lost time and expenses for the employer. Who operates Retain in Minnesota? As I said, I'm from DEED. Sam is from Mayo Clinic. We also work with health partners. And then on the workforce development side of what we do, we work with Workforce Development Inc. and Goodwill Easter Seals. One thing that is a recent change, though, is that our team actually championed a policy change for state dislocated worker, which expanded the eligibility criteria to include folks that are ill and injured, but do not have a workers' comp case that affects their employment. So that's really bringing the entire workforce development field in Minnesota with our WDAs and our SLIGs to where Retain is at. So that's a very exciting development, and us at DEED have quite a few policies that we need to roll out regarding this, and we'll be working with WDI to come up with some trainings for the field. So just at a high level, to take a step back, really our goals are to keep people at work, to find those accommodations or restrictions for ill or injured individuals, and ultimately reduce long-term work disability. We know that work is one of the social determinants of health. And even when you have sort of that injury or illness that's impacting your employment, if you can maintain employment in some capacity, those folks actually have better health outcomes than folks who do not return to the workforce. And there really is an impetus on helping people return to work too, because the longer that an individual is out of work, the less likely they are to ever return to the workforce. So we're really trying to be that early intervention to make sure that people aren't, you know, getting onto SSDI or other sort of programs unnecessarily when they don't need to be necessarily. So just a quick overview about, some of the ways that we really see illnesses and injury affecting organizations. Of course, there's time away from work, high cost for work-related injuries. We know very well at the state the costs related to replace workers, and just that administrative overhead. If there are sort of those injury and illnesses on the job, the insurance cost increases, potential, regulatory oversight. And then there really is, a reflection on, an employer. We always strive to be, employers that do the most for our employees. But sometimes, you can't. And that's, a loss of competitive ability if you're shedding employees, aren't able to accommodate, and that can have an effect on a company's image. And bringing this back to sort of the macro that we're working in, according to the National Safety Council, there are huge costs and time associated with illnesses and injuries that are incurred every year. In 2021, which we have the most recent data for, you can see it's $167 billion in costs associated with work injury. And 103 million days lost. So it's a huge amount of productivity that's being lost due to work injury, staying off work, and stuff like that. So that's really, the environment that we're trying to operate in and move the needle for employees and workers. So I think I might hand it over to Sam here, and she can walk through, eligibility and some of our processes.
Thank you. So as John mentioned, we do have eligibility criteria to be enrolled into the program. So we're really looking at individuals that are 18 years of age or older. They need to be a Minnesota resident and also work in the state of Minnesota. They need to be employed at the time of enrollment. So that's one of the big changes from when we were doing the clinical study to now this being a program. We were finding that we were having a lot of unemployed individuals coming into the program, and we weren't able to do enough to get them back to work within the 6-month time frame that we have. So that is one thing we changed. So they do have to come to us with being currently employed. They have to have worked at least one day within the last 6 months. And that's again because we're trying to do that early intervention piece. Some of this criteria, it's more for our team. We don't expect anyone to memorize this, but they have to be unable to work for at least 4 weeks or anticipated to be out for at least 4 weeks or more. So individuals that are having an upcoming surgery, as long as they know that it's going to be impacting work for at least 4 weeks, we can enroll them prior to that surgery. So really meeting one of the following, either a diagnosis of a work-related or personal injury or illness that's going to impact their employment, or having that invasive procedure, so surgeries, or anything else that would kind of take them out of work for at least 4 weeks. Another new change that we're requiring is documentation of the work restriction. So if it's a male patient, we can easily see that information in the EMR system. However, they don't have to be a male or a Health Partners patient. They can doctor anywhere throughout the state, and we're able to still work with them. We just need to have that written note that they do have restrictions from a provider. And that's because we were seeing a lot of people that were self-restricting, and then their healthcare provider wasn't agreeing. So it was hard for the program to really do what we're meant to do. And I can kind of take this slide too, John. So really the process for employers or anyone out in the community is to identify anyone that has an injury or illness. Again, it can be work-related or non-work-related. I would say 95% of our population is those non-work-related injury and illnesses. So really those individuals that are dealing with personal injury or illness. Individuals can be referred to us in multiple different ways. They can self-refer, they can be referred by their healthcare provider, they can be referred by you guys, they can be referred by their employer. So really, however we can get the word out and get people in the program is fine. They can go right on our website and there's a referral tab. So if you guys are working with someone and they're okay, you can fill it out for them. And then you can also call us or email us, and that information can be shared too. Our team is really quick at being able to follow up with people. So we kind of say within 24 hours, we can get people in the program and get them started. I would say even sometimes, it's same day, depending on our availability. We really try and meet people where they're at, because sometimes if they're calling, they need the help right now. They don't want to wait a couple days. They really want to get started. So that's one thing that we really try to do is get them enrolled in start services immediately. John, if you want to take this one.
Yeah, for sure. And I just will put one caveat that right now, Retain currently is enrolling because we're transitioning into this sort of sustainability pilot for us. But we anticipate that enrollment will open back up in a few weeks here. And so we'll have a message on our website and everything like that. Right now it says, we're currently active but not enrolling. But yes, that'll restart in a few weeks here. So some of the things, for employers and stuff like that, we work closely with the Employer Reasonable Accommodation Fund, so they can help support small to medium-sized businesses actually get reimbursed for accommodations for their employees. So that's a great perk for folks. That self-referral process that Sam talked about, we're super open. However, if we work directly with HR, stuff like that, like we're very flexible. And then our return to work case managers, we really try to work with, employers, their providers, and really just have sort of that plan put in place that works for everybody to get people back to work. And then we also, have the clinical expertise to provide those workplace accommodations and restriction recommendations for folks. And then, unfortunately, not everybody is able to be maintained by their current employer. So whenever that's the case, we do have employment and training services when needed. And that can involve career exploration, upskilling, credential and non-credential training, on-the-job training, and referral to other workforce development resources as needed. So how you can help, we really want to connect with organizations that understand the value of return to work. So we're trying to strengthen our partnerships, especially, in greater Minnesota. I'm based here in St. Paul. So definitely building those connections, through southern Minnesota and the Mankato area is a priority for us. And also getting the news out there. We have a lower enrollment goal for this sort of sustainability period that we're doing, but we still really want to serve as many people as we can. So sharing information, connecting us with networks. It's great that we were invited here. We really appreciate it. So yeah, that's a really brief overview of Retain, and I think that we can open it up for some questions.
Thank you so much for that presentation. That's a lot of good information. And anytime you, I guess all of the individuals on the call are more than happy to connect you to networks and whatnot. And a lot of us work within that employment and training realm. So we're either doing, the training, or we're trying to do the job counseling or help keep people employed. So a lot of the same goals. So did anyone have any specific questions?
Is the slideshow being shared, or are we just gonna have people go back to the recording?
I am
We can share
happy.
the PowerPoint. Yeah.
Okay, yeah, if you want to send it to me, I can send it out in my recap of the meeting. That would be awesome. And if you have any flyers or anything that you want shared as well, I can certainly put that in there. I usually kind of type up a recap of everything talked about with contact information and all of that. So,
Perfect.
And what if, I have a question, what if the client ends up doing, a workman's compensation thing? How does that work with your programming?
Yeah.
Yeah.
So,
Oh, go ahead,
sorry, you
John.
can go for it, Sam.
So we can still work with individuals that have workers' compensation claims. However, in the state of Minnesota, we have QRCs, so those qualified rehabilitation counselors, that provide very similar services to what our return to work case managers do. So if at any point they are assigned a QRC or they get a lawyer to go after litigation towards the employer, we would close them from the program just because it's seen as that duplication of services. And with it being a research study, we don't want to put our staff in the line of fire of being called into court. So those are kind of the only caveats with those with workers' comp claims. However, our team has been pretty successful at getting people back to work prior to that QRC being assigned. And that's normally around the 12-week mark, unless if they have a pretty catastrophic injury, then they're usually assigned pretty quickly.
Okay, thank you.
You're welcome.
So how
So,
do we get a hold of you? Like, did your contact information, Samantha, was that on the slides? Or,
Yep.
Yep, there's contact information on the slides, and we can
Okay.
provide, our direct emails too.
great, awesome, thank you.
and can people, no matter where they work, access this program, whether it's they're working for a little mom and pop and maybe there's only 4 or 5 employees, or they work for a huge corporation?
Yep. It doesn't matter where they're employed as long as they're employed in the state of Minnesota.
Okay. And does it matter whether or not they have healthcare coverage?
No, it does not. Our team has actually helped quite a few individuals gain healthcare. So we help them kind of through the process of applying for Medicare, Medicaid, whichever they may need.
How long do you continue to work with them once they are back at work?
So we typically wait until they hit 30 days of being back to work unrestricted. And so we kind of find that that's the best time where if any issues are going to arise, it's going to be right away. However, they have 6 months of total eligibility from the day they enroll. So say someone went back to work unrestricted, things were going great, and 2 months down the road, something happened and things aren't going so well. As long as they still have eligibility left in the program, we can reopen them and continue to work with them again.
And is like mental health illness considered one of the illnesses?
Yep. So any injury or illness.
And you said you work with, like, if you have someone who maybe doesn't have to stop working, but just needs accommodations or different things, you could work with that person as opposed to just being done working, finding a way to stay at work with accommodations?
Correct. We would work with both the employer and the healthcare provider to ensure that, if they need work restrictions or they need accommodations, that we're able to get those into place. And for individuals who employers are saying, no, I'm sorry, we can't accommodate, that's when we'll typically go back to our workforce development partners to see if they can find alternative roles that someone may be able to do either in that same employer if they need that upskilling, or if there's something outside of the current employer that would be better suited for them long term.
So maybe I missed this, but does someone have to be working somewhere and then need help while working, or is it like someone who's unemployed could use your services?
They do have to be unemployed or employed at the time of enrollment.
Okay.
Sorry. Yeah. So prior, when we were trying to enroll a large amount, we were enrolling those that were unemployed. However, on the medical side, there's not much we can do because we're not helping with restrictions. We're not helping with accommodations. And we were finding many of these people were remaining unemployed for this full 6 months. And retained because we have that 6-month cap. It's really hard to get them back to work and get that career counseling, that career training that they need. So we did limit this next portion of the program. However, that's temporary and things may change again where we reopen that eligibility, especially with the changes to dislocated worker. I think that's going to open up a whole new level of services because there's not that 6-month gap or that 6-month time limit.
And so at the end of 6 months, if someone is not able to return to work, would you, like, because I work with people sometimes who are applying for disability, and like that would be good documentation to show that like they worked with someone and they weren't able, like after working with you and the healthcare person, they weren't able to return to work. Do you provide like documentation or?
Our team does not because it's a research study. However, you know, we
Okay.
can kind of work with their provider and let them know. However, with retain, one of the stipulations is they cannot have applied for SSDI or SSI because
Oh,
we're
okay.
trying to keep them in the workplace.
Yes.
So
So if
that,
they were, okay, it would
yep,
be after maybe
yeah.
if they
So,
wanted to continue to use your services.
yep, if they hit the 6 months, you know, we do try and see if there's other programs that they can enroll in. So maybe at that time, we're giving that referral over to VR. Oftentimes they're already working with our workforce development partner. So they're looking to see if there's other programs they may qualify for.
Okay.
So at least, you know, we're not just saying, hey, sorry, you hit 6 months, see you later. We are trying to look for other resources to help them.
Perfect. Any other questions? I will try to type up some notes and the contact information and share that with the whole group. That way individuals that maybe watch the recording later have access to it as well. But any other questions? Otherwise, we really appreciate you sharing your resource so that we can widely share it for you as well. We're going to move into roundtables, so you're welcome to stay if you want to hear about other agencies. Otherwise, if you need to leave early, you're welcome to do that as well. So,
Sounds
Yeah,
good.
thank you so much.
yeah. I guess I can just start it off for roundtable. So, I guess just general updates. We're still taking referrals for adult dislocated worker programs if somebody wants to do training or go on for school, or if they just need help with job search, the dislocated worker program can also help with that. So enrollments are through Career Force. I can also attach a referral form as well. We also, MVAC's annual fundraiser Lip Sync. I just wanted to put a reminder that that's in September. We're still looking for sponsors and I think some lip sync teams. So Anne would be the contact for that, and I can put that in our follow-up flyer as well. If you know of anybody that wants to participate, or if you just need the date to attend. Let's see. I know there's our FAME program as well was still looking for participants. So that is a match savings program if they have a goal of buying a house, buying a car, going back to school, or opening a business. So Leah is the contact for that. And I can also put that in our follow-up as well. Anybody else have program changes or events coming up that they'd like to share?
I can start. I'm Michelle with Employment Services for Blue Earth County, and I have my coworker who's newer to our office also on today. So it's Melinda Krantz. So yeah, just wanted to introduce her, and that's really about all going on. We just have the same old every day. All the clients, same referrals are still coming in and helping to the best of our ability. So that's all.
Awesome. Welcome.
I can go next. Oh, sorry.
Go ahead, Sage. That's okay. Go ahead.
That always happens, doesn't it? Paige with Vine, and just wanted to give a couple updates. Tomorrow we actually have a fundraiser with the Mankato Moondogs, so if anybody is interested, the weather is supposed to be good. And the game is at 6:30 p.m. and the tickets are $16, and they include obviously your entrance to see the game, but then also includes a hot dog, chips, and soda. So if anybody's interested and wants to support Vine, please go to the Moondogs website, and then in the promo code, use the word Vine, VINE, to get those tickets. We will also be celebrating the Vine Adult Community Center's 10-year anniversary in July, so next month. We're going to have a celebration going on July 16th, so there'll be some information about that coming out soon, just kind of celebrating our last 10 years, and then also kind of talking about where we hope to be in the next 10 years. We also have our Vines Love Your Age 55 Plus Expo is going to be on September 17th, if you haven't already heard about it. And it's going to be at the Civic Center again from 1 to 5 p.m. If you want more information about that, it is on our website, vinevolunteers.org. We're already over 50% of our booths have been sold. So if you haven't signed up for a booth already and you want to get a booth, I highly recommend getting that in sooner rather than later, because I anticipate we'll be selling out of booth spaces and the price goes up after July 31st. We also will be offering free rides for True Transit to the Blue Earth, Nicollet, and LeSueur County Fairs again this summer. So we'll be doing free rides on July 25th to the Blue Earth County Fair, free rides on August 9th to the Nicollet County Fair, and free rides on August 16th to the LeSueur County Fair. And that's for anybody in Blue Earth, Nicollet, or LeSueur counties that would like to go to the fair. We pick people up at their door and we drop them off at the fair, so they don't have to worry about parking or driving. If anybody wants information about that, they can go to truetransit.org, or they can call our True Transit and set up their ride request as well. And then lastly, this is a kind of out into the future, but our next diabetes prevention program, which is a free program. It is a year commitment though for anybody who is pre-diabetic that wants to prevent getting type 2 diabetes. We'll be beginning on Tuesday, September 24th. We have 2 info sessions coming up about it at Vine that are also free to attend. They will be held on August 27th and September 10th for anybody interested. And I can email you, Emily, all that information I just spattered off, so everybody can have
Much
more information about
appreciated.
it. And that's it.
Thank you. And Karen, if you wanted to share your updates next.
Adult Basic Ed Summer School started yesterday at the Lincoln Community Center. We had 2 days of vacation from the end of the school year. So we're in summer school now, and our day classes are Tuesday, Wednesday, Thursday mornings, and our night classes are Tuesday, Wednesday nights. We will do enrollments again the beginning of July. So people who are in for June and July, and if some people drop, we'll open up some more intakes in the beginning of July. We do have the summer bridge classes, the healthcare and the manufacturing. If people are interested in those, the flyers are out there in the South Central College website is where they register. They can also call the Adult Basic Ed office to inquire, and we can work with them a little ahead of time if that's what they would like to do. I think most of you know about those healthcare bridges and manufacturing bridge classes. I think that's about it.
I can also put the flyers in the follow-up email.
That'd be great. I forgot to mention the GED boot camps. So we have GED preparation going June and July, but we also have kind of a faster boot camp going in July for the people who are pretty high scoring and won't take very long to get through their GED. So if there are people out there who want a quick option to get through their GED, they can just call the Adult Basic Ed office and we can sign them up for those July boot camps and get it all done in 1 month.
I can go next. Kate Henke-Grutz with Lutheran Social Service. I coordinate the crisis nursery. And I see a couple of names that I don't recognize, so I'll do my elevator speech. The crisis nursery provides short-term child care when families are experiencing stress. So it could be anything from a job interview to medical appointments to maybe that parent who has 3 little kids and hasn't had a shower by herself in the last 6 months and just needs a parenting break. Care is for children ages 12 and younger, and can be for a couple of hours up to 72 hours. We use licensed providers, family center-based, and also foster care providers. No cost to the families, no income guidelines or citizenship requirements. We can do the paperwork over the phone, and people just need to call us, and then we'll try to find a provider who has an opening. There's no guarantee until we do talk with a provider who does have space. When they're available, we give out diapers, wipes, blankets, toothbrushes, that type of thing. And I spend a lot of time doing resource navigation with families. We need more providers. So if you know anyone who's licensed, I'd love to talk with them. And we also need a couple more on-call volunteers. So if you want to encourage people to call, that would be fantastic. LSS continues to offer financial counseling. No cost for those services, figuring out their budgets, understanding credit reports, maybe getting ready to buy a house, etc. Our youth programs continue to provide services to at-risk and homeless youth. There's a hot meal that's served every afternoon, Monday through Thursdays at the Reach. And then there's also our Safe Harbor program that does sex trafficking prevention training and also services for people who've been sex trafficked. And then we've got a myriad of other services: adoption, foster care, guardianship, our meals primarily for seniors, etc. And if anybody would like to have a speaker, I would love to come and talk to your organization about the crisis nursery. Thank you.
Kate, I do have a referral for the financial counseling. How do I make that referral to you? By email or?
And you could do that, and I could forward it to Michelle Stile in our office. Actually, I think about 80% of our financial appointments are done over the phone.
Okay.
So I will put the phone number for our financial programs in the chat, and it might actually
Perfect.
be best if the person just called there, and then they
Okay.
would hook them up to the counselor that is available and has the correct training.
That sounds great. Thank you.
Yep.
Yeah, it's a great resource. I've used it myself actually. And yes, they do, speaking from experience, they typically require you to call to set up an appointment and then they take it from there. So, yeah. Any other updates? I thought of one more thing. You mentioned diapers. MVAC did get awarded a diaper grant of sorts. So if there are participants that are working with any of our employees like on a program, we have diapers available. I know Head Start got the bulk of them. So for their Head Start families, they had a variety of sizes available. And then I believe, again, we're getting more in July. So we would have more for the other county offices. But if you know anyone who's working with MVAC programs like Head Start, any of the employment and training, SNAP, all of those, they could talk to their counselor and might be able to access that. A lot of our offices also have basic blessings. So again, if somebody is working with an MVAC staff, or I believe for most for the basic blessings anyway, we accept walk-ins. So if somebody needed, soap or household basic cleaning supplies and whatnot, some of our offices have basic blessings as well. So I just thought I'd mention that since you mentioned diapers, it made me think of it.
Hey, Emily.
Yep.
Since you mentioned the diaper bank thing, Catholic Charities is one of the organizations that also has a monthly diaper bank.
Okay.
So do you know if clients can double dip per se?
I would think so. I guess I will check on that because this is recorded, so
Yeah.
I'm sure I'll be quoted, so I will check on that.
Yeah.
But my understanding is that we were given a special grant and it's based on if this year goes well,
Yeah.
that we would just be awarded that amount going forward. And we got, like thousands of diapers. So as long as it goes well and it's being utilized and we're filling out the demographic form, I think they would be able to access other resources because they're separate. But is there another MVAC staff on the call that knows a little bit more? That maybe would have, yeah.
Hi, Emily. It's Veronica with Catholic Charities.
Oh, yeah.
Michelle,
Hi.
thanks for mentioning that. I was, yeah, so we also received the Minnesota Diaper Grant.
Okay.
And my understanding is that clients can't go to two different, but that's really difficult to, like, how would you,
Track.
to track, correct?
Okay. I'll look into
so-
that then, because that's good to know. I know that it's for clients, so they have to be working with a counselor, and there is a form we have to fill out. So that's a great question. I will make note to follow up, and then the ones, well, I guess I will relay that to everyone then, just to follow up on that answer, because that's a good point. I guess I'm not sure. I think yeah, that would be hard to track, I think, especially if we're not sure what other agencies somebody is working with. Because I've seen the form and it's more so just demographics. It doesn't ask if they've worked with anyone else. So I'll look into that. That's a great question.
Yeah.
And Emily, when I've talked with other MVAC employees about the diaper bank, they have said that if non-MVAC people stopped in and asked for diapers, they wouldn't be turned away.
Right. We also, so some of our basic blessings have diapers too. So it might be too that we have separate pots of, or not pots, but I always say pots of funds, but we have separate resources. Like some of our offices have Salvation Army, some have, all of them have this diaper fund, and then some of them have just basic blessings from the community. So yeah, if we had it, and it worked out, we wouldn't turn someone away.
And same with us at Catholic Charities. They don't have to be a client. If they need diapers and they have little ones that need diapers, they can come to us once a month.
I've also heard that Feeding Every Baby and Birthright tends to use the 1 time a month guideline also.
Perfect. That sounds good. I'll look into that though. That's a good question and we should know the answer to that. So I will see what I can find out.
Do you know if being on energy assistance is working with somebody at MVAC? Does that count?
Yeah,
I mean,
I would.
Yeah, it
energy
is.
assistance
That
is
counts.
over, but
Yeah. Yep. Yeah. They're in our MVAC system
Okay.
if they filled out an application. So yeah.
okay.
And I know the program year ended for that, but yeah, if they were working with someone at MVAC, again, we wouldn't turn them away if we have the availability to help. Yeah. I guess just a recap, if there's anybody else that has something they want to share, they certainly can after this. But the next networking meeting is September 11th at 1 p.m. I will type up notes from this meeting and send them out. I'm gonna try to get Kata to be our next guest speaker. I had connected with Julia at the Adult Career Pathway Networking Day, and she mentioned she could talk about caseworkers and how to respond when somebody expresses that they have safety concerns or, had experienced violence. So I'm going to see if it works for her to join. But as always, if you have different topics or programs you'd like to know about, certainly send your ideas my way so that I can try to navigate that and get them to attend one of our meetings. So I also know Care Counseling did respond back and they'd like to attend a future meeting, so I'll try to make that work as well. But again, if you have other ideas, I'm always welcome or open to hearing about them as ideas, because I run out of ideas eventually if I don't have some input. So and I want the speakers to be speakers that are going to be useful and helpful for the populations you're serving and the work that you do. So yeah.
Has
Yeah.
MACV presented here? Oh, okay. I've never heard them a lot about. I've referred people, but I was just wondering if they hadn't then.
Not since I have taken this position. So I can certainly look back. I'm not sure if Danielle, who had this position before me, if she recorded them. I can't remember. She did, Michelle?
No, I don't remember if they were recorded back then, but I remember with Danielle McVie was a presenter.
They
But
were a presenter.
I
Okay.
think that would be also a good agency
Okay.
to hear back from, since it's been a while now.
Yeah, I will add them to my list, maybe for December or the following one. I'll see if I can get them. Yes, and then it's a lot of things change too. So I will certainly take that down. Thank you for the suggestion. I think that's a good resource. So
We could also consider inviting MACV to the Blue Earth County Homeless Response Team. And that group meets, just a second. It meets the fourth Tuesday of the month from 8:30 to 10 at the Intergovernmental Center. There's also a virtual option. And there tends to be, between in-person and virtual attendees, there tends to be like 30 plus people each month. So a great chance to do some networking at that meeting also.
thanks for sharing.
Mhm.
Okay. Any last thoughts? Otherwise, I can maybe gift you back 15 minutes of your day here. I'll be honest, I got my times mixed up and I was ready to go at noon. And then I was like, oh, I have an hour. So that was my awkward moment today. I'm all out of sorts. So we made it though. Perfect. Okay, well, I will let you go. I will try to type up everything as usual. If you have any flyers or anything that you'd like me to share with the group, I will add them to my email. It usually takes me at least an hour to compile everything, so it'll, feel free to still send something and I can add it to that email. If you have questions, you can always follow up with me, and then I will try to get this recording up on the website shortly. So thank you.
Bye.